Hello, everyone. My name is Adrian, and I am the Education and Community Liaison at the Nanaimo Brain Injury Society. Today, we are recording our June education session, and we're going to talk about headache self-management. And we've invited Dr. Jamie Dunnett, a physical therapist, to come talk about that with us. Jamie works as a physical therapist at CBI Health Group in Nanaimo, assisting patients with varying degrees of severity and brain injury. Brain injury rehabilitation has been a passion of his since graduating from UBC, and he has since completed his doctoral of physical therapy. He also sits on the Programs and Services Committee at the Nanaimo Brain Injury Society. So welcome, Jamie.
Good, thank you, Adrian, and thanks to all of you guys for tuning in. This is one of my favorite presentations to give. I often give it to patients post-concussion, as headaches are extremely common, not only from concussion, but from other types of brain injury, particularly traumatic brain injury. And patients generally find this quite useful. Usually people can find one or two helpful bits to go and try to better improve the way they're managing their headaches. So without further ado, let's get into the presentation. Adrian, if you can just share the slide so I can move it along again. There we go. All right. And so oftentimes, I'm sure a lot of you out there feel like this character here. So her head is in a vise, she's got a nail going into her eye, she's got a crack in her forehead, she's sweating, things just aren't going well for this individual. And that's oftentimes what patients feel like with a headache following a traumatic brain injury. And it's important to understand that the head is actually the most common location that humans experience pain. Out of all the different parts of the body, the head is number one. In fact, something like 9 out of 10 adults will experience a headache at some point in their lives. I would say, if anything, even more. I was thinking 100% of people might get a headache at some point. And then down here at the bottom, 47% of adults experience a headache in a given year. That's according to the World Health Organization. So the message is that they're extremely common, and they're by no means isolated to just concussion or other kinds of brain injury. These occur normally in people's day-to-day lives. However, following a concussion, they are particularly common. In fact, they are the most common symptom following a concussion. Over 90% of patients who sustain a concussion end up reporting headaches at some point following the injury. What's very interesting, though, is that patients with concussion tend to have more issues with headaches than patients who have moderate and or severe traumatic brain injuries. And there's a couple of studies suggesting this. So headache is really the hallmark of a concussion injury, although it can occur with other kinds of injuries as well. So why does it hurt? I don't think there's a perfect answer for this yet, but one of the leading theories is this concept of sensitization. So sensitization occurs when the nerve endings that are located in the tissues in the body become more sensitive, such that normal levels of stimulation cause them to cross a threshold and fire a pain signal in towards the brain. There's also amplification that goes on at the level of the spinal cord. So messages coming in from the peripheral nerve can become dialed up, if you will, or amplified at the level of the cord, and even the part of the brain that is responsible for receiving this sensory information, called the thalamus, that can become more sensitive as well. So you've got the three parts of the nervous system that become more sensitive. And so essentially normal levels of stimulation, so normal levels of light, normal levels of noise, normal levels of stress, those kind of things then become perceived by the nervous system as being painful and result in a headache. It's important to understand that this is not isolated just to the head. This can occur with chronic pain in the low back, the shoulder, various other locations as well. following brain injury, it's oftentimes the head where the pain is reported, and the hypersensitization is one of the leading theories about why this occurs. So, how do I know if there's something seriously wrong? Well, fortunately, headaches are actually very rarely due to serious disease. It is possible. And when you're being examined by your medical team is thinking about the possibility that any one of these symptoms could suggest that something more serious is going on. And so they're looking out for signs, they're looking out for symptoms and patterns that may suggest this. So when you go in to see your family doctor, you go in to see your physiotherapist, there are clues that we would be looking for and potentially testing for that could suggest the need for more sophisticated testing, such as CT scans, to rule out more serious disease. But the main message here is that very rarely is a headache a symptom of a more serious condition. So is there anything I can do? And this is where the point of the presentation really becomes clear. The answer, of course, is yes, or we wouldn't be having this presentation. So yes, there's a lot that anyone suffering with a headache can do. So we're going to go through this. And so the idea, we'll do all of this today, is to learn some intervention strategies and begin learning how to apply them. You're also going to learn how to collect information about the patterns of your headache. And then we need to understand the role of headache hygiene. The basic idea here is that there are things you can do during a headache to mitigate the pain. There's other things you can do in your life to essentially reduce the likelihood of a new headache coming on, or if a headache does come on, it'll be less severe. So we're going to look at both of those. So the first one, these are self-intervention strategies when you do have a headache. And there's a couple of different categories. The first one here is physical. So the lady over here on the left is taking ice or heat and actually applying it directly to her head. Oftentimes people have pain in the frontal region. So what she's doing is just applying some ice directly to the head. The head is covered with muscles. And so just like you might ice a shoulder or a knee, there's absolutely nothing wrong with applying ice directly to your head or heat. And in some people, they actually find quite a bit of relief once this is done. The lady at the bottom here, this is interesting. It's oftentimes reported that patients, when they apply a counter pressure to their head, that this can actually reduce some of the pain being experienced. So the lady here at the bottom has got a headscarf and has tied that, somewhat tightly around her head. And in some cases, this might actually reduce the headache pain. There is an association between headaches and neck symptoms. So it's possible that actually applying some treatment to the neck might also assist with the headache. So the person can give themselves a self-massage, they can apply some heat or some ice to the neck, and sometimes this helps to reduce the headache as well. So second thing is relaxation. Now this is very important. So the most important part of relaxation is the deep breathing. When we say deep breathing, we mean slow, deep inhales, a little hold at the top of the inhale, and then a slow exhalation as well. You'd like to see the diaphragm expanding, so the belly pops out to allow that diaphragmatic drop when the inhalation does occur. And we know from some interesting research studies that deep breathing, such as this, for even as short as 6 minutes, can have a significant impact on blood pressure, as well as heart rate, as well as tension in muscles. So all of these things can drop, and all of those things potentially are contributing to a headache. So simply by deep breathing for at least 6 minutes, if not a little bit longer, the person can potentially alleviate some of the pain associated with their headache through some of these other mechanisms. The other thing one can do is visualization strategies. So this is really a simple technique where somebody thinks about a beautiful location or possibly a really important person in their life, or anything that brings them peace and relaxation. And while they're doing their deep breathing, they can just picture this particular scene that brings them joy. And those two combined can be very powerful at helping to reduce the headache. The third thing is, manipulating the environment. So in the case of the person over here on the left, so she's lying down, so she's changed her position with respect to gravity. So oftentimes if a person has a headache, going and lying down for a few minutes can be helpful. The lady at the bottom here, so she's adjusted the light and noise in the room. So she's dimmed the light, she's made it nice and quiet. You notice she's also lying down. So the brain doesn't have to work as hard to process this stimulation that's coming in because there's less of it. And finally, the gal over here on the right, she's gone outside. So patients that are, tend to spend predominant amount of time inside may benefit from simply going outside onto a patio and having a few breaths of fresh air. It's amazing how that can help in certain individuals. And what's important to understand with all the things I've just showed you is that they can be combined. In fact, that's how they work best. So a very typical strategy patients use when they have a headache is they would go and lie down. They'd reduce the stimulation in the environment, so reduce the noise and light. They'd take a hot pack or an ice pack, whatever they prefer, and either put it around their head, put it around their neck, or both, and then engage in some deep breathing and visualization, and do this whole process for about 15 minutes. And if they went into the plan with a 6 out of 10 headache, pretty sore, it's very possible that after doing this for 15 minutes, their headache might drop down to about a 2 out of 10, in which case they can get on with the other things they can have to and want to do with their life. So thinking about these self-intervention strategies in combination is oftentimes very helpful for the patient. We then get into triggers. So triggers are a variety of different things that can activate a headache. Remember I said at the beginning about the system being more sensitive. So none of these examples of triggers are dangerous for the body. These are just things that when combined with a sensitive nervous system can set off a headache event. So they're not damaging or harmful. They just initiate, if you will, the headache event. So it's important for patients to understand their triggers. So following traumatic brain injury, the more common ones tend to be the physical one at the bottom here. So neck pain, overexertion, too much activity can result in a headache. Even exertion with the visual system, so a lot of time focusing on a computer screen, for example. Environmental. Sleep patterns is often very common after traumatic brain injury. So sleep can often be disturbed as well. And if somebody has a distorted sleeping pattern, that can make them more prone to developing headaches the following day. And then stress. This is a big one. So at work, at home, with family, there's lots of potential avenues that stress can be apparent for the individual, especially in these days with a pandemic going on all over the world. There's lots of stress. And so it's important to make a relationship between stress, between sleep, between neck pain, physical exertion, and your headaches. So not everybody has all of these triggers, but it's important to be able to understand some of the patterns that are occurring with the headache and what might be preceding the headache and setting off the headache event. So headache hygiene. So this is really important because these are things that people can do that can minimize the risk of future headaches occurring. So it will potentially desensitize the nervous system slightly. So there's two components to this. One of them is lifestyle hygiene. The second one is trigger management, and we'll look at both of these. So first of all, lifestyle hygiene. So these are things that I think most of us would understand are healthy behaviors. But what I want you to do here is to make a connection between some of these healthy behaviors and your headache. So people would often think of sleep as, if they're tired the next day and frustrated at night because they can't sleep. But I also want to make a connection between poor sleep and the potential to have more or worse headaches. So restorative sleep, very important for a whole host of reasons, including headache management. The most powerful thing somebody can do if they're having sleep issues is to go to bed at the same time and wake up at the same time every day. And that'll prime your brain to there being a time to go to sleep and a time to wake up. However, there's lots of other things the person may need to do, including something called headache hygiene, and including possibly medical or psychological interventions as well. So main take home here, if you do have headaches and your sleep is altered, you're going to want to take some steps to try and get your sleep going better, because that in turn can have a powerful effect on reducing your headaches. Eating regular meals. Okay, so there's two parts to this. First of all, there's the regularity of food intake. So the brain is a very hungry organism. It uses a lot, or organ rather, it uses a lot of blood sugar in order to sustain itself and to operate. And so the brain needs a regular supply of blood sugar. And although the body will find a way to make sure that the blood sugar levels are more or less sustained in the blood, including the delivery to the brain, it makes it easier on the body to do that if you have regular intake of food. Ideally, this food would be healthy and nutritious. So you're aiming for a balanced diet with adequate nutrition. But the important thing here is to take a look at your lifestyle. If you're skipping meals, you're going a long time between food intake, you may want to look at redistributing your food intake more regularly throughout the day. If you have headaches, this may help with your headaches. Managing stress. So we've talked about this. This is a big one. This is a very common trigger. It is incredibly complex. Some of the more straightforward things that patients can do at home include the deep breathing, which we've talked about, getting some gentle exercise, which we'll talk about more in just a minute, and some simple yoga routines. However, if those are inadequate, you may need assistance of a psychologist, a physician, a counselor, an occupational therapist, or other healthcare professionals that are specifically trained in how to help individuals manage their stress. But if you have high levels of stress and you're having headaches, you may want to try and address the stress as best you can, and that may very well in turn help your headaches. Hydration. So much like food intake, we want to be having a regular fluid intakes. These would ideally be non-caffeinated beverages such as water, juice, milk, depending on who you are and your preferences. Water works great. You want to minimize the caffeine consumption, so not eliminate necessarily. Couple cups of coffee are probably okay, but if you're having 8 cups of coffee a day, you may look at cutting back on some of your caffeine intake as well. Same with aspartame, which is an artificial sweetener that is a known dietary trigger in some individuals. So stick to healthy hydrating beverages and just make sure, particularly in the summer months, that you're getting adequate fluid intake. So if you have headaches and you're having erratic fluid intakes, you may want to try simply making that more regular and see if that helps with your headaches. Finally, regular exercise. So this is important in just about every medical condition, including headache management. What we're talking about when we say regular exercise is really simply walking. That'll do the trick. 20 to 30 minutes, moderate pace. If you can do it daily, that would be fantastic. Otherwise, aim for 5 days a week. In certain individuals, when you have higher levels of exertion, that may actually activate a headache. So if you're prone to that with activity, then you keep your walking at light levels. So you keep your heart rate lower, and that should be a way to be able to get around any exertional type headaches. But getting regular exercise is extremely important. So look at your lifestyle. If you have headaches and you're not tending to any one of these 5 or 6 things I just mentioned, try adjusting those. Give it a couple of weeks and see if it has a positive effect on your headache. It very likely will. So trigger management. So we've already seen this slide. Triggers can come in a whole wide range of forms. What the idea here is if you can figure out the pattern, so in other words, what are the triggers that on an individualized basis are known to set off your headaches, then oftentimes you can manage the triggers, and this becomes a strategy to manage the headaches. So it's important to understand again that these are not causing headaches. What caused the headache is the traumatic brain injury. These are simply activating headaches. So these are normal levels of stimulation. These are not harmful to the brain in any way. These are simply activating. So what you want to do is learn more about what these triggers are in your case, and then try and adapt them. So if it's a dietary trigger, for example, processed meat, aged cheese, red wine, these are all things that are notorious for provoking headaches, particularly the patients that have migraine type headaches. Well, if you can figure it out, then stop eating it. That seems like a pretty simple one. Too little sleep, so that's a bit more complicated. It is something you'd want to address, but you want to be employing some sleep hygiene strategies and possibly seeking assistance from other professionals to assist you with that. Barometric pressure change, so this is a tough one. There's a lot of patients, again, particularly with migraine type headaches, that get headaches when low pressure systems come in, storms come in, particularly in the winter. So you can't change the weather. You could move somewhere where you don't have these storms, but besides that being pretty impractical, who wouldn't want to live in beautiful Vancouver Island? So what I suggest for those people is check the weather, and if you see one of these systems coming on, you're going to want to prepare some of your intervention strategies. So you want to get very good at being able to manage a headache when they come on, some of that stuff we talked about at the beginning, and maybe modify some of your plans for the day. If you're likely to get a headache on that day, maybe just try and plan around it and take strategies to try and mitigate the headache when it comes on. So medications, so these certainly can have a role in headaches, although as I'm sure most of you who have headaches who are listening to this know, they range in effectiveness and probably shouldn't be used as the only intervention. So they may be prescribed by a physician to help with headaches, but they should be a complement to some of what you've learned in this presentation. It's very important to take them as prescribed, and it's also very important to not rely on them in high doses on a daily basis for a long period of time, because one can develop a separate type of headache called a medication overuse headache. So if you find you're using large amounts of medication, even Tylenol, and you're doing this on a daily basis and you're doing this for week after week after week, you probably want to follow up with your physician to see if there's some other medication that could be used less frequently. And you definitely want to be looking into some of the self-management strategies that we've covered here today to complement your medication use. So what I want you guys to think about are, what are 3 important things that you've learned today about headaches? If you have any other questions, you can please contact the Nanaimo Brain Injury Society. They are a wonderful resource to help point people in the right direction about how to get assistance for their brain injury related problems. I would like you guys to reflect on your headache pattern. Are there any triggers that stand out? And if so, might you be able to manage those triggers? And I'd also like you to experiment with your self-management action plan. So the next time you get a headache, think about some of those things we've covered today, and try them in combination. And again, see if you can reduce your headache intensity by 50% in 15 to 20 minutes just by combining some of these interventions. Most people are very successful at being able to do that. So I wish you guys luck at managing your headaches. Hopefully you'll all take something useful away from this. And thanks to the Nanaimo Brain Injury Society for asking me to make this presentation today.
Thank you very much, Jamie. That was awesome. I think a lot of our clients will get something out of that for sure. I just wanted to mention that June is Brain Injury Awareness Month. So anyone interested in knowing what we're doing and what we're up to, go check out nbis.ca, and we will see you on the next session. See you later. Bye, Jamie.
Bye-bye. Thank you.